this afternoon is foot disease. So let's get started. I'm going to sound like a broken record, but very, very important to start with the signalement. There are some diseases that are more frequent in younger individuals, let's say Demodex, and others are more frequent in older individuals, like metabolic disease. So signalement is important. We want to know how long the disease has been going on, how it has progressed. If we want to know if it's just the feet or there are other areas on the body that are also affected, because that helps me to rank my differential diagnosis. I want to know if it's just the front feet or all 4 feet. I'll give you an example. The atopic dog typically starts with the front feet, starts licking the front feet. Eventually, it may do all 4, but it starts with the front. The flea allergic dog will work mostly on the back feet. The contact allergy dog, it doesn't matter, right? Because you kind of have contact on all 4. So it's important to know. I want to know if there is pruritus and if there are primary lesions. Because, for example, diseases like contact allergy will have a primary eruption, which is a papular eruption. So it's important for me to notice that when I examine the dog. It's also useful to know what the response to previous therapy has been, because it kind of helps me to figure out if there is any resistance of any sort. We want to always start with common things first, right? We don't want to look for zebras right away. We want to look for horses. So we want to make sure anytime that you have foot disease, you want to rule out Demodex. Either the animal is already on an effective treatment for Demodex, like Simparica, Credelio, Bravetto, Nexgar, any of those will do. Or you have to scrape those feet or do some hair pluck, or somehow you have to rule out Demodex. But with pododermatitis, it's critical that you rule that out. You also want to think of dermatophytes, because there are dermatophytes in the soil that definitely are a differential diagnosis for this. And then, of course, the secondary infections, right? So that is always a common theme in derm. No matter what the primary disease is, you're always dealing with this bacteria and yeast that complicate things further. So we start with skin cytology, and I think it's critical that we try to do this as much as possible every time you have a skin case, okay? It's very difficult to manage these cases if you're not allowed to do some cytology. You want to know what kind of cells are there, what kind of infection is there. The picture here is a cat with pemphigus. So pemphigus in cats has the peculiarity of affecting the nail bed. So just by squeezing that nail out, getting that material in the nail fold and doing a cytology and finding the acantholytic cells, something as simple and quick as that can give you a tremendous amount of information. The deep skin scraping is critical to do something to rule out Demodex one way or the other. This picture here is a dog with demodicosis. It's easy to confuse that with allergies, so it's very important that we don't miss that. And then anytime that you see a foot like this where the nails are distorted, think about dermatophytes. Dermatophytes like skin and hair and keratin, so they have a propensity for the nails, so that is critical. There is nothing that looks like that, so you want to definitely think about dermatophytes anytime you have that look in terms of nail disease. So let's get I'm going to go by category. So again, we're going to look at more pictures of Demodex. I'm sure you've seen a ton of cases like this. But again, I wanted to drive home this message that Demodex can cause hyperpigmentation. So you can have the Demodex dog that is pink and red and itchy, and the Demodex dog that has this dark skin, like you see in these images. And so these are all Demodex, okay? And so you cannot, no matter how good you are as a clinician, you cannot just say one way or the other. It's very important to scrape these dogs. And document whether you have immature stages or just adults. It gives you a sense of prognosis. Sometimes students ask me, but if I just find a couple mites, is that okay because they're normal part of the flora? The answer is no, because the chances of you finding the couple mites that are present in the whole dog in your skin scraping is close to zero. So any positive scraping needs to be taken seriously, okay? And then the other question that they ask me, but if they're dead, is that okay? The answer is no. You know, any Demodex mite, even if it looks dead on your skin scraping, it still needs to be taken seriously and treated. And Demodex can cause severe secondary infections. Of course, at this point, nobody wants to scrape a foot like this. So I encourage you to proactively now prescribe these drugs. I know that some people are afraid of Bravecto, and I respect that. But so pick the one that you feel comfortable with, knowing that you may have adverse effects with anything that you're going to prescribe, right? So, but pick one and treat these cases. In the category of infections, I mentioned dermatophytes. So M-gypsum is the one in the soil, and trachophyton is the one that is transmitted by where the reservoir is rodents. So both have this predilection to affect the feet, and so you have pododermatitis as well as nail disease. So just a few pictures of what you may expect. So you have the skin is affected, but you can also see that these nails have an abnormal curvature. They're distorted many times. They're brittle. And so these are things that you want to consider. Again, so different presentation. This dog here on the right, you know, there's one nail that is definitely affected. The other one may not be, but the one in the middle is definitely the one that you would want to submit for culture. And so the question is, you know, why should I submit a fungal culture if something looks like this? Well, I think for one, you want to know what kind of dermatophyte it is. And I'll give you an example. In my experience, anytime I've had M-gypsum, and I'd be curious to see what yours is, but typically those animals were immunosuppressed. So I've frequently seen it with dogs with heartworm disease, for example. But trachophyton is something that I will be looking for a reservoir. And so I treat these cases differently. I also, if I get trachophyton in a Yorkie, then I know that I'm in for a long run, because Yorkies, for some reason, get this horrible infections with trachophyton, and it takes a long time to clear them. Okay, they can also affect the foot pads, and notice how popular that is, right? Because dermatophytes are a cause of folliculitis. So it makes sense that you have that kind of like little dots on the foot. So these are all clues that can help you to rank your differential diagnosis. Now, back to the dermatophyte for a second. How would we treat dermatophyte? You want to select antifungals that have propensity to accumulate in the nail. Your best options are itraconazole or terbinafine. And now even I recommend people to use, in the States, we have this nail polisher that people use, you know, when you have fungal infection on your toenails, that you can paint your nails with terbinafine or tolnaftate and so on. So I ask owners to do that. So you want to basically have something that stays in the nail for extended periods of time. Now, moving to different kind of presentation, we talked a little bit this morning about interdigital cyst and deep pyoderma. So let's talk a little bit more about that. So it's a frustrating condition. Typically big, heavy dogs, short-coated, Sometimes they even have some deformity in the way they walk, or you know, so they have some kind of anatomical predilection for why they get in the predicament that they do. And so they get this deep infection, and then soon enough they develop this cysts. And the cysts are the results of basically furunculosis, where the hair follicle is ruptured and you have release of bacteria and free keratin in the dermis. And as a consequence, the body walls off, or at least attempts to wall off the infection and all this foreign body, creating like a capsule. And so these capsules are a constant source of reinfection. So this is why these cases have a high level of recurrence. So the way I think of these cases is almost like a dog that is walking around with a bunch of little abscesses, right? That basically they keep on releasing some level of infection. And sometimes they can become very disfiguring. They can definitely affect the quality of life of these patients, and very painful and so on. And I encourage you to figure out what the bacteria is. This dog had Pseudomonas on his feet, and figure out what bacterial infection you have and put them on the appropriate antibiotic rather than do guess trial. The chances of you solving this cases just with topical therapy, in my experience, is minimal, because the infection is too deep. Many of these dogs also get Epsom salt soaks to kind of help, you know, earlier on, not this a case as bad as this, but early on, you know, to kind of help to establish a drainage. We pack the feet with mupirocin and steroids overnight, baby socks, so they kind of like you have all this topical treatment under occlusion, attempting to reach deeper. Sometimes I use the cyanotic. Dr. Torres explained this morning that it's the fact that you have the steroid plus the DMSO, so it drives the drug deeper in the tissue where you need it. And so these cases typically require a combination of topical and systemic, and a few eventually may even need surgical removal of the cyst. I have attempted fovea with these cases with minimal success, but in the US, fovea is kind of like a trendy thing to try anytime you have these infections, and some clinicians have had good success with that. I don't know if you have leishmaniasis here. In Europe, we certainly have some. And it's moving to the US. At least Texas has quite a few cases. But the point is, it is one of the differential diagnoses when you have pododermatitis, and particularly nail involvement. You have onychogryphosis. So it's something, one more differential to keep in mind if you do your cytology, or if you have nodules and you do a fine needle aspirate, you know, to look for leishmania. Changing categories, we're moving to allergies and immune-mediated diseases that can affect the feet. Okay, allergies, that's an easy one, right? So we talked about, and we'll talk more later today about allergies in general, but specifically atopic derm. So again, very common, and in my experience with atopic dermatitis, is you're more likely to have diffuse erythema on the bottom of the feet, but with contact, you'll see the primary lesion. So I put an example of both. The one on the right has contact, the one on the left just has AD. And so when you observe these cases, kind of pay attention whether you see the little dots. So if you see the little dots, there must be a contact component. Some of these dogs, in my experience, have both atopic derm and contact. And so, of course, they are very itchy. And the majority of them also have a secondary infection. So the pruritus can be extreme, and some dogs start on the bottom, but then eventually they start chewing on the top, and they can create a tremendous amount of damage, and some dogs develop really chronic lesions, and so the skin tends to scar, and so those are cases that require prolonged treatment courses. If you put them on antibiotic, it's going to be a long time because the skin is so scarred. This dog had contact, and so it was all 4 feet, very, very itchy, okay? Basically, it was mutilating his feet. And this discoloration of the nails, I'm sure you know what it is Malassezia paronychia, right? So when you have a yeast infection in the nail fold, the nail that is supposed to be white eventually start growing with this rusty color. There is no other differential for that rusty discoloration. So every time you see something like this, you know that among other things, you also need to address the yeast infection. We talked about that a little bit yesterday. I just put some pictures of plants that commonly cause contact allergy, and I'm sure you have some varieties here as well. All these plants are very allergenic. I encourage you to look for them and do a patch test to diagnose these cases. It's kind of like an easy disease to fix, if you will, but in my experience, it is largely underdiagnosed and is a cause for treatment failure. So again, some dogs are very obvious in their pruritus. They develop the salivary staining, and so it's very, and they can be very intense and create a tremendous amount of damage. A disease that is peculiar of the feet and in cats is plasma cell pododermatitis. And these cats will come to you with the swollen pads. It's basically this excessive inflammatory response, which is thought to be allergen triggered. So these cats, they get this soft, swollen foot pads. They can become very uncomfortable, sometimes painful and reluctant to walk. So we need to do immunomodulation in these cats, as well as identifying the trigger for the disease. Moving from plain allergies to autoimmune disease, pemphigus is one example of a disease that can target the feet. And in this case, the crusting on the feet is layers and layers of pustules. So they kind of dry up, and then you have this hyperkeratosis. But hyperkeratosis is a bad term because it's an histological term that we use to describe a crusty foot. But in this case, they quote hyperkeratosis is just a bunch of pustules, which is different from the hyperkeratosis of the Cocker Spaniel that has a primary disease of keratinization. So those crusty feet look very different, right? In this case, again, it's a pustular disease. Again, as different cases of it. This one you can see a little bit better, kind of like the layer, right? So this is kind of like if I were to peel this and I use it for cytology, I'm looking for acantholytic cells. Maybe, maybe not. And cats, like I said, have this predilection of the nail fold. Okay, this is a great place for cytology. The rest is similar to dogs, right? The face, the ears, and so on. But the nail fold is a peculiarity of cats. So great place to look for acantholytic cells. So try to convince owners to agree to that. Look for your acantholytic cells. Look for an infection. And then, many cases we do a biopsy, but I think the paronychia with acantholytic cells in cats is pretty pathognomonic for this disease. Other autoimmune diseases that can affect the feet is pemphigus vulgaris. So it is the same category, pemphigus, but it's much deeper disease. So it's an ulcerative disease because the primary lesion is Ebola, not a pustule. and so you have this large ulcerated area. And then systemic lupus can also cause pododermatitis. It's typically in conjunction with a lot of other things, right? So these dogs they're systemically ill, and they frequently have other manifestations, also vasculitis. We have talked at length about vasculitis and the many triggers, and the foot is definitely an area that is frequently affected. Many of these cases require immunomodulation, and you start with typically high doses of steroids plus pentoxifylline. The induction is typically 2 weeks long, and then once you get some form of remission, you can start tapering the steroids while leaving the pentoxifylline the same, and then eventually, hopefully, you can wean them off the steroids and keep them on pentoxifylline. Other category of diseases that can affect the feet is metabolic diseases. So I already mentioned that earlier this morning, the hepatocutaneous syndrome, whatever, however you want to call it, superficial necrolytic dermatitis is one of the terms to basically describe the fact that you have necrosis in the skin. And the causes for this, many times it's a liver disease, sometimes it's related to drug use, but you can also have the ones where the underlying cause is diabetes or some other pancreatic disease. Clinically speaking, skin-wise, these animals develop these necrotic lesions. I talked about the ulcerative lesions in the genitalia area this morning because they get that, but they also get crusting, and particularly the first place is they get crusting on the commissure of the mouth. That is typically missed by the owners, or mistaken as some kind of former lip fold pyoderma. But then they develop crusting on their feet. Okay, they develop crusting that can become severe. They can have cracked foot pads. They can become very painful and reluctant to walk. So look at this foot. So this foot is very different from your pemphigus foot. Do you agree? So the pemphigus was basically a bunch of layers of pustules. This is just like fissures, right? So and all this crust that you can see is the level of parakeratosis that these animals develop. I don't know if you remember from this morning when I talked about the biopsy and I said red, white, blue, the features of this disease. Well, the red in the histopath is all that crusting that you see on that foot. So it's severe parakeratosis, and that you can have also this is obviously a much more advanced case where the crusting around the mouth has become severe. And then, of course, you can have the ulcerative lesions that we discussed this morning, and the feature, once again, is in the genitalia area. So once again, this is pathognomonic for this disease, red, white, and blue, parakeratosis, then the edema in the middle of the epidermis, and the blue is the hyperplasia of the basal cell layer. How do we treat this? This morning somebody asked me, how do I go about it? Well, we talked about blood work, right? So these are things that you will see, and commonly in these cases, they are anemic, most of them. They have increased liver enzyme with the different variety, but most of them, they have some increased liver enzymes. They have low albumin. Some, they may also have high glucose. Those are all things that kind of like increase your level of suspicion that you might be dealing with one of these cases. But the treatment is not steroids. The treatment is nutritional support of these cases. So it can be as simple as changing the diet to a puppy food. So you want to have something that is rich in protein. And then you want to supplement with amino acids. The simplest thing that you can do is orally. So at least in the US now, we're flooded with all the supplements for bodybuilders, right? Because we're all gonna be strong and muscular. And so there are all these products that people can buy online. They're amino acid products. And so you can supplement the food with that. That is the simple, easiest, cheapest thing to do. Some people add egg yolks to the regular diet. So anything to increase the protein content, the fatty acid content. And so those are all simple things that can be done. These dogs also benefit from zinc supplementation. I put this information in your slides so that you have it. And so depending on the formulation of zinc that you use, the dose is different. And then many people also supplement with fatty acids. So eicosapentaenoic acid is the traditional supplement that people have recommended. It's basically fish oil, okay? There are many different formulations, but at least you have the dose here. And then for the most severe cases, you can do intravenous amino acid supplementation. And so we reserve that for like very severe cases. It's something that needs to be done over an extended period of time. It becomes more expensive, more involved. But that is something trying to turn around the most severe ones. So if you diagnose these cases early, I've had one that lived up to 2 years. But when you read the literature, it says the survival time is 6 months. And I think it has to do with how early these cases are identified and treated. You know, if they are far gone, like some of the last pictures I showed you, then typically they don't live very long, okay? But when we do the intravenous amino acid supplementation, we kind of recheck them in a week and see if they're getting any better, and we decide whether we need to do another treatment and what the prognosis is. But again, you can start with oral supplementation if people don't have the resources. We already talked about zinc-responsive derm this morning, talking about crusting diseases. I'm going to talk again about that in the terms of pododerm and foot-pad disease. So these dogs have also the parakeratosis, but different from the hepatocutaneous dog, you don't have that red, white, and blue. You just have this thick level of keratin. And again, these dogs, it's not that they're on a poor diet, they just need additional zinc supplementation. Cutaneous lymphoma is a recurrent theme, right? Because you can have so many different manifestations, so that we are also talking about lymphoma in the context of pododermatitis. So some of these dogs also develop crusty feet, you know, but that's almost the least of their problems. They have all kinds of other issues. The nasal depigmentation is one of the first signs, you know, so kind of something to be aware. And then, of course, they develop the nodules, the plaques, the more obvious signs, the gingivitis, and so on. But cats can also develop paraneoplastic skin disease, secondary to thymoma. And the feature in this case is that the skin gets that shiny appearance. So, it's something very particular about this disease. So you may see these older cats that suddenly lose weight or lose the hair, and the skin has that kind of plastic, shiny appearance, and they may also have the scaling on their feet. And so that's a paraneoplastic syndrome. But you can also have benign situations where the hyperkeratosis is just the primary disease of keratinization. It's just who that animal is, and as long as we keep it hydrated with some urea, it's no big deal. So, this foot pad looks very different from the other ones that I showed you, right? So it's just who that individual is. Now I'm going to move to things that are specific for the nails. So before I talk about diseases, I wanted to introduce some terminology. Onychoschisia is the splitting of the claw. Onycholysis is when it basically the nail gets detached. Onychomalacia is when it gets soft. And then onychodystrophy is basically when it gets all deformed. And so there are diseases that I will describe where you have all these changes in the nail. Onychographosis is the abnormal curvature, and you will see that in the dermatophyte case that I mentioned before, in the leishmania case. So these are changes that you are more likely to see with some specific diseases. And then you can have ingrown nails just like, people can have. Now, how do I divide diseases? Okay, I start with simple things first, right? So we talked about the dermatophytes, the bacteria, Demodex. Okay, got it. I only had one Demodex case in 30 years that also had nail disease, and I think it's because there was so much damage in the matrix of the nail that the nail itself got deformed. But otherwise, Demodex is not really something that will specifically affect the nail. Then you can have metabolic diseases, that's a nutritional, immune-mediated, autoimmune. That's a category that I kind of lump it together. And then I have diseases that just are specific for the nail, and I'm going to focus on symmetric lupus onychodystrophy because of all the various specific nail diseases, SLO is the one that I'm confident you're going to see or you have seen because it's not that incredibly rare, at least in my experience. So you rank this differential diagnosis thinking of the signalement, whether it's one foot that is affected or multiple foot and nails, if there are also other skin lesions and what the distribution of the lesions is. So when I deal with SLO, the average age of onset is typically a middle-aged young adult, okay? I have seen it in any breed. I don't think that I can kind of rule it out or rule it in based on breed. I've seen it in a lot of greyhounds. I've seen it in mixed breed dogs. So I think breed, to me, it doesn't matter too much. But they start with pain, walking, and then they start sloughing nails. And it is an immune-mediated attack of the basement membrane in the nail bed area. And what I want to show you some pictures because there's nothing like SLO, okay? These pictures are classic. And what SLO does is that the nail starts lifting. So this is the, quote, old nail that is lifting, is separating, and is replaced by this abnormal, fragile, distorted nail. This is the same. So this is lifting, and it's going to be replaced by this one. Always the same. Okay, my plea to you, don't do what I have seen done in the US over and over and over. What happens is this, they slough a nail, the local vet cuts the toe, they amputate the toe, and they think that that's the answer until a few weeks or months go by and then another nail does it, and then they repeat the same. And it's only when toe number 3 is affected they start thinking that maybe there's something else that should be done. So now I beg you, look at these pictures. There is nothing that does that kind of stuff. You don't even need to biopsy these dogs anymore. In the past we used to say you need to biopsy the nail fold. Now I can tell you if it looks anything like this, I promise you it's SLO. So this is a dog that obviously has lost this 3. This one is the only one that is left, right? So it's a very painful disease, and so I encourage people to keep the nails very short so that when they walk, they don't touch the floor because that in itself is very painful. So when you look from underneath, so this is a dog that is about to slough, right? So you have basically a different view of the same concept, right? So this is the new nail, and this is the one that is lifting. So they develop this hollow nails. It's incredibly painful. So it's critical to provide these animals with gabapentin, tramadol, meloxicam, whatever you find comfortable prescribing, but something to help with the pain. So this one has already lost all of them, right? So he has nothing left, okay? And they can keep doing this. Now, most of these dogs is only the nails, although I have seen some dogs with SLO also developing other signs of vasculitis elsewhere. So I think there is a spectrum of immune-mediated diseases that these dogs get. But the run-of-the-mill SLO dog is nail only. They don't get anything on their foot pads, nothing, just left the nails, okay? So I don't biopsy these dogs anymore, so, but you do need to use steroids. So we start with an immunosuppressive dose of steroids, and then you can use a steroid-sparing agent of your choice. Some people use azathioprine for the severe ones. Some people use just fatty acids and tetracycline niacinamide. In my experience, tetracycline niacinamide alone is too benign to really make a difference for these dogs. I frequently also use pentoxifylline, but definitely they are going to need other steroids or Apoquel. If at all possible, I encourage you to use the steroids first. And then, you know, you can use the fatty acids, but more as a supplement. Fatty acids alone are not going to make a difference for any of the cases I showed you. And the tetracycline niacinamide is a combination that is used in the literature for things like discoid lupus and SLO. Some people think that it's more benign, but the truth is that you can have side effects with these drugs too. And so it's important that people understand it's 3 times a day. Most of my owners don't have time to do this every 8 hours. And the dose is very vague, you know, more than 10 kilograms, less than 10 kilograms. So I think we're not dosing these drugs appropriately. So in my mind, it's something that, you know, if it's a super mild case and people are totally opposed to steroids, okay. But if I have anything severe, I would not expect for that to make a difference. Pentoxifylline, I use it a lot as an adjunctive therapy, but not as monotherapy. And then, you know, like I said, in some cases they're so painful, surgery might be needed when they fail treatment. So that was SLO. Now moving along, other things that can affect the nails. We already talked about vitiligo many times, and vitiligo can also affect the color of the nails, and so that's a benign change of nail color. And, you know, as it can affect leukoderma, leukotrichia, the rest of the body. And we said Rotties are prone to it, Siamese cats are prone to it. And then malassezia, right? Remember that dog with contact allergy? That rusty coloration of the nail. You may not have an exudate. You may not have much stuff to do with cytology. Still, if the animal is chewing on his nails and they have that color, then you have to treat for malassezia. So, to wrap all this up, I can tell you once again that in order to approach these cases, you need to be systematic. I encourage you once again to look at your segment, look at your history, and look at, you know, all 4 feet, just front, just back, what kind of lesions I get, how rapidly it's progressing, are the nails affected, yes or no, are the footbeds affected, yes or no, and then you rank your differential diagnosis and start with the common things first, and then go for the zebra or the ones that are like less common. Some diseases, you know, you may need to biopsy to have a final diagnosis, like, for example, the hepatocutaneous dog. But some, they're so clinically distinctive, you don't need to biopsy, like the systemic lupus onychodystrophy. That's what I had for you, and I'm ahead of schedule. So you guys have any questions? All good? So steroids most of the time, as well as other immunosuppressive agents. Yeah. My experience, cutaneous lymphoma does not respond as well as the regular lymphoma, but they still attempt, you know, chemotherapy, typically CHOP treatment. I see another hand. Green shirt.
One. As you discussed, there is hyperkeratinization happening in various dogs and cats, but the conditions are different conditions, like as a, take an example of ZRD, but apart from that, there will be some other diseases as well. So how to differentiate between, can we have a list for that in which the hyperkeratinization of the nose happens, and how we will differentiate amongst all of these, because the difference in the approach and the treatment is quite different. So either we have to do the cocktail therapy, or we have to arrive at some right diagnosis. So hyperkeratinization, as we have seen from the morning, there will be different condition bearing this particular symptom, hyperkeratinization of the, and all are looking similar. So how to differentiate amongst that?
So if I understand your question on the nose?
Yeah.
Yes. Well, I mean, it really depends, again, in the context of the rest of the patient, right? So whether it's a young patient that has had a crusty nose all his life, and that would be a benign hyperkeratosis that I don't even bother biopsying, versus one that has developed hyperkeratosis later on in life. And based on that, I kind of like, first of all, I decide whether I need to biopsy or not. And then most of the time, biopsy would be necessary to get a final diagnosis, but you can have a pretty good level of suspicion based on everything else. In other words, whether it fits the picture of an autoimmune disease versus a metabolic disease or versus something else. But ultimately, if it's not the young dog that always had a crusty nose and crusty footpads, the other diseases, to have a final diagnosis, they all require